But we have been really aggressive with bone on bone and getting some results and seeing on MRIs the cartilage regenerate. But yes, doctors who work in a trauma center are used to these egregious fractures and malformations and things. And you go in with, my hip hurts and I'm not the same. And it's got some degenerative change or what people call arthritis, and they misuse that term all the time. And you may get dismissed. You may get, you'll be fine, lady. Go home. Just walk it off. Go do some physical therapy, more physical therapy. And the problem is they throw more anti-inflammatories, more cortisone shots, and that actually, even though there's a role for cortisone shots in the acute phase of severe pain, if you can't survive, as a long-term repetitive management tool, actually works against you.
Doesn't it degenerate the tissue even more?
It messes with the inflammation, anti-inflammation cycles that our cells use to work. And we want our cells in the most anti-inflammatory mode. And if you suppress that with an anti-inflammatory, then they don't do the repair that goes with acute inflammation, right? If you cut yourself, your body sends cells that are inflammation to heal it. And as we get older, we don't heal as fast because our stem cells aren't working as well, which is an argument to use the younger stuff. That's an inserted advertisement.
So in terms of joint pain, when you talk about, you're doing what you can to help people avoid surgery. Obviously, by the time people are bone on bone, you may have, I'm guessing you have some success there, but what if somebody came to you before that? How do people know that it's time to see someone like you who's in this space of saying, if we can regenerate any cartilage in someone who's bone on bone, imagine what we can do for someone who's starting to see degradation, who's starting to see that osteoarthritis. And now we can really pull you back from the ledge.
100%. The earlier we help someone that doesn't have more advanced stages of the degenerative change, the easier it is to help them and the quicker we can help them, generally speaking. So how do they find us?